You've worked in a variety of roles from EMT to state EMS director to assistant secretary. How'd that happen?
So first, thanks, Jay. Thanks for having me here, and that's a great question. I think there are a number of variables that have gone into it, whether some of that is the educational attainments, some of that are the people who've mentored me and helped me get to where I am. Some of it is just being open-minded about new positions. Probably one of the biggest leaps I had to make in my career was when I jumped from EMS into public health. And I jumped back into EMS, and now I'm in a much larger role that encompasses several different public health initiatives at the same time. None of the career jumps were ever easy, but they were always worth it. And they always took a lot of time, consideration, mentorship from other people, as well as me utilizing muscles that I don't necessarily utilize regularly.
So, what are some of the programs that you have in your portfolio?
So right now I have 5 bureaus that report to me. There's the Bureau of Emergency Medical Services, as expected. There's the Bureau of Public Health Preparedness, the Bureau of Community Health Systems, the Bureau of Epidemiology, and the Bureau of Laboratories. In addition, I'm the designated incident commander for Governor Tom Wolf's opioid disaster declaration.
A lot on your plate. What are the key leadership traits that you think are most important?
So I think probably the first one would be understanding how to communicate. And that's a lot more difficult than people give credit for. Whether you have a mission, a vision, an organizational view, or anything else, if you're not able to communicate with people, those who report to you, those that you report to, and even those on the sides of you, if you can't communicate with them effectively, you're really not going to get anything done. One of the additional leadership traits that I always tell people to focus on is finding a mentor. There are people out there who've had to do what we've had to do before or something similar. Finding them, understanding how they got to where they are, how they did what they did, and even their educational attainments and other things like that, that's critical. But probably one of the most important is leaders never stop learning. So whether that means doing Google searches with critical terms or reading the trade or academic journals or even books about leadership, leaders never stop learning. And we never stop setting goals and objectives for ourselves. So one of my goals early on was, even just a few years ago, was to be speaking at Pinnacle. Goal accomplished.
What was one of your most troubling experiences as a leader, and how'd you work through it?
I found myself unemployed, and it was a difficult personal and professional moment. And it's moments like that that allow us to reflect on things that have gone well and things that haven't gone as well. I know a lot of leaders who've found themselves in occupational positions where they've hated it. I know a lot of leaders who found themselves unemployed. And you take those moments and you try to learn from them as much as humanly possible. The position I'm in right now, I've probably never been happier occupationally than I am right now. Yes, I'm challenged, and as I just told you, I have a ton of responsibilities, and I love it. It's an amazing position, and I'm very glad that I fell up.
You know, I've always admired that your faith tradition is a big part of your life. How has that influenced your career success?
That's very interesting. I tend to feel like there's a bigger presence out there keeping an eye on all of us. And that might sound strange to some people, but that is the way I look at things. So yes, I pray and I give charity and I try to do other things as well. But I understand that I'm just a piece in this giant puzzle. So there are things that I do, but I also understand that there's a bigger picture. And sometimes I look at the actions and the things that have happened to me, the positive and the negative, and I look at them in totality. And I say, this was great. And I say, and this is something that taught me a lesson. And maybe you'd call that faith. And that is the way I generally view it.
Ray, from your perspective, what are some of the longer term issues and challenges for EMS?
So I would love to be tongue-in-cheek and say I'm much like Aretha Franklin, and I think RESPECT is a big challenge coming up. But I think that we really need to delineate better what we do and our worth. And so I look at certain actions, including Mayor de Blasio's comments about the work being different while defending a pay disparity, or even the PTSD bill that came out of Connecticut where they wrote out emergency medical services providers. And I think we haven't advocated enough for ourselves. We haven't done that in an effective manner. We haven't told people who we are and what we do and why we're good at it. And we need to keep focusing on that. I also look at the ET3 initiative coming out of CMS, and I think to myself, this is good. Finally, 30, 40 years down the road, we're actually moving from a transportation model to a clinically based model in regard to reimbursement for EMS services. I think that at the same time, probably one of the biggest challenges for me is our managers. I think our managers need to step up and become formally educated. And even conferences like Pinnacle, they assist in managers understanding what's out there, what the trends are, what different EMS systems are doing, and how to best handle what all those things are. So I think that we're leading in interesting times, and there's a lot going on at the same time. And I think EMS managers really have to take that moment to step up. But I think we have a lot of challenges at the same time.
Thanks for joining us for this edition of Fitch Insights. Look for another issue in your inbox in the future. For more information about the leader development programs or consulting services of the firm, visit our website, www.fitchassoc.com.